Hey everyone, and welcome to today's Explainer. Today, we're diving into a super important health topic, emphysema. It's a serious but thankfully manageable lung condition that falls under the larger COPD umbrella. Let's get right into it and break this down, simple and clear.
Before we get into the heavy science, I want you to do something for me. Just take a deep breath. Pretty easy, right? But imagine if that simple, automatic act of breathing felt like a daily battle. For people living with emphysema, well, that's their everyday reality. So why exactly does this happen?
To really picture what's going on, imagine you have millions of tiny little balloons inside your lungs. When you take a breath in, these balloons expand, and when you exhale, they contract. That's basically exactly how healthy lungs work.
Okay, let's dive into this. Here is our roadmap for today. 1. What is emphysema? 2. The main causes. 3. Symptom progression. 4. Diagnosis. 5. Treatment and prevention. And finally, 6. Emergency red flags.
Let's start with Section 1. What is emphysema? So, in medical terms, those tiny balloons we just talked about, they're called alveoli. Their main job is absolutely crucial. They deliver fresh oxygen into your bloodstream. They act literally just like elastic balloons, stretching out to take in oxygen and shrinking down to push out carbon dioxide. And this brilliantly illustrates the difference. On one side, you have healthy lungs where fresh air moves in and out completely freely. But with emphysema, the walls of these little air sacs actually start to break down, and they lose that vital elasticity. The result? Old air gets trapped inside, meaning your body gets less fresh oxygen. That's exactly why people start feeling so breathless.
Moving on to Section 2, the main causes. Without a doubt, the biggest external culprit here is smoking, and we mean cigarettes, bidis, hookahs, and even passive smoking. That constant exposure to smoke severely damages the lungs. But it's not just tobacco. Heavy air pollution, dust, factory smoke, and chemical gases can also completely wreck those delicate alveoli over time.
Now, you might be wondering, is it always environmental? Actually, no. Genetics play a big role too. Some people are born with a deficiency in a protein called alpha-1 antitrypsin, which leaves their lungs really vulnerable. Plus, long-term chronic lung infections can directly lead to emphysema as well.
Section 3. Symptom progression.
The tricky thing is, the early signs are really subtle. We're talking about feeling breathless when just climbing a flight of stairs, a chronic cough that won't go away, a tight chest, feeling constantly tired, unexplained weight loss, and wheezing. Seriously, please do not ignore these early warning signs. As the disease progresses to these severe stages, things get incredibly intense. Because of an extreme lack of oxygen in the body, a person's lips might literally turn blue. At this point, the breathlessness is so severe it happens even when you're just sitting down and resting. Section 4. Diagnosis.
Thankfully, medical science has precise ways to identify this. First up is usually a spirometry test, which basically measures your lung capacity. Then doctors will likely run a chest X-ray or a CT scan to get a clear visual of the damage, followed by specific tests to check the exact oxygen levels in your blood.
Let's pivot to Section 5, Treatment and Prevention.
So, the crucial point here is this. Emphysema is not completely curable. Once those alveoli break, they don't bounce back. However, and this is a big however, with early detection and the right treatment, it can be highly controlled. You can absolutely still live a normal, active life.
Treatment happens in steps. Step 1, and literally the most important thing, quit smoking. From there, doctors can prescribe medicines like inhalers, bronchodilators, or steroids to help open the airways. If oxygen is super low, oxygen therapy is a true game changer. There's also pulmonary rehab to build lung strength, and in very severe cases, surgeries like lung volume reduction or even a full transplant.
Okay, so how do we protect ourselves moving forward? It's pretty straightforward. Avoid smoking and heavy pollution at all costs. Wear a mask when you need to, exercise regularly to keep those lungs strong, and treat any lung infections right away. Also, getting your flu and pneumonia vaccines is a huge, huge help in protecting your respiratory system.
We need to address the elephant in the room. Is emphysema fatal? Well, yes, if left entirely untreated, it is very dangerous. But remember, with proactive care, early detection, and the right lifestyle tweaks, people can and do live normal, fulfilling lives for many, many years.
Section 6. Emergency red flags. Please memorize this. Go to the hospital immediately if you experience sudden, severe breathlessness, sharp chest pain, notice your lips turning blue, or if you start coughing up blood. These are massive red flags, and there is absolutely no time to wait. We've covered a lot today, from those millions of tiny lung balloons to how we can protect them. So I'll leave you with this one question. Are your daily habits protecting your precious lungs, or are they harming them? Take a moment to think about that, and take action today. Thanks for joining us for this explainer, and stay healthy out there.